Good morning. Well, I guess I shouldn't say good morning because I don't usually say good morning.
Okay.
Greetings to all you out there. This is Nikki Corinne White, and I am the leader for Live Boldly Ministries podcast. And today I'm fortunate to have my sister, Lisa Shumaker, who's been an RN for years, and she kind of took a turn there to become a clinical coordinator for a stroke program. And Lisa, why don't first of all, I wanted to say, I find people on the front lines and people who are nurses to be very intentional and purposeful. And that's one reason we wanted you on our podcast. And so I am so thankful for anyone like you, but they'd be able to do that stuff. So it's just great. So I would like to know kind of what led you after being a nurse towards stroke program.
Well, thanks. It's good to be here sharing with you. I was an RN in the medical telemetry area, which are people who are on heart monitors that have all sorts of different disease processes. And an opportunity came about where our hospital was going to start a stroke program, and we were going to get approved and certified by the Joint Commission, which is the governing body for hospitals. And this opportunity came up, and I thought, wow, I could learn something new. And I'd already been a nurse over 20 years. Then the opportunity, my manager said, well, sure, you can do this for a while, but you'll have to get your bachelor's. I had an associate's degree. So I'd always thought, I don't need a bachelor's to take care of patients. I'm doing a great job just the way I am.
And you were.
This gave me that little shove.
Yep.
And so at 53 years old, I graduated with my bachelor's in nursing. And that was like 14 years ago. And I've been doing this and enjoyed so much the new learning. It's not just one thing. Nursing is like that. There's so many different things you can do with nursing.
Absolutely.
So this was one of those things.
Absolutely. And so there was some personal aspects too why you chose stroke.
The patients I took care of sometimes were in the hospital just for any other thing, and they actually would have a stroke in the hospital. So I'd actually witnessed that back at that time, and it was a good opportunity. Later, after I had started doing this work, some family members actually had strokes.
Yeah. Okay. So for those of you just tuning in, I'm speaking with Lisa Shumaker, who's an RN and a stroke coordinator for stroke program. And she is going to talk to us about symptoms and things we can do and things we can learn in the second half of our show. You're listening to Live Boldly Ministries podcast. Lisa, what do we need to know about stroke?
Stroke is very common, and some of us don't think that, because you've mentioned before, and other people I know, I never knew anyone that had a stroke. Mm-hmm. People will tell you that. But 800,000 people in the United States have a stroke each year. It's exceedingly common, and for that, we're sorry. But we need to know the symptoms. Back in the 60s and the 70s, many TV shows would show somebody clutching their heart, falling down their chest, and we all learned, wow, that's a heart attack. But we never saw anybody having a stroke on television, did we? So let's learn those symptoms. You can learn them. Your kids can learn them. Mm-hmm. And then you can teach that grandma and grandpa, get a magnet on the refrigerator. So we want to think fast. So facial droop on one side of the body, arm weakness on one side of the body, changes in speech. It could be slurred or a difficulty speaking at all. It can also be a sudden onset of dizziness or a change in vision. And that's always an emergency. And you call 911 because we need to get people into the hospital as quickly as possible when it's a stroke.
Mm-hmm. And what's the T?
Time to call.
Time to call. Thank you. Just had to follow that.
Good.
So what are some things that we can do to prevent strokes?
Right. We really want to prevent strokes and heart disease. And they're very connected. Think blood vessels in the heart, blood vessels in the brain. We're trying to keep these open and things going well. The number one cause of heart disease and stroke is high blood pressure. So if you have high blood pressure, you need to treat it and work with your primary care provider to keep that under check. Smoking is a high risk for both of those and many other things. And that's something you can actually stop. If you have diabetes, you can't get rid of it, but you can control it. Controlling your diabetes is a way to help improve your chances for not having heart attack and stroke. Increasing your activity, walking, doing something that you can do to increase your metabolic rate and make you healthier. There are things you can't change. Like we can't change that we're getting older, right? We can't change if our family had a history of strokes, or if you had a prior stroke, because people who had a stroke before or a TIA, transient ischemic attack, they're at risk for stroke. We can't take those things away, but these things that I've mentioned, plus several others, illegal drug use, sleep apnea, these are things along with high blood pressure, smoking, cholesterol. We need to treat these things and keep them under check and keep an eye on them.
Yeah, I've actually known several people now that I'm getting older who've had strokes, little ones. And then I had a friend who was in her 30s who had a big one. And she is at the gym every day. And she's like greatly improved over the last 5 years and done amazing things. I just and really look up to her for all of that. But she has the aphasia. She can't speak correctly. She'll think something in her head and it comes out a different sentence. And it's very frustrating. So she's now working with people to bring awareness to that. Can you tell us something about that aspect?
Aphasia is very difficult for the people who have it and for the people who love and know them. Several of the things that are a result of stroke make life really difficult. It can be one side doesn't work. It can be aphasia. It can be difficulty swallowing. It can be loss of vision, hearing. So all of these things need attention and a workaround. Aphasia has its very own difficulties and challenges. And there is actually an aphasia network in the Northwest. It's started out of Portland, and they run a camp. So many resources for folks who know people, love them, or people who've had stroke are on the American Stroke Association. It is at stroke.org. The aphasia, when you meet someone that has aphasia, and it could be from a stroke or it can be from other diseases also, or a head injury. When you meet someone like that, you need to think in your head, they are having difficulty speaking. Their intelligence may completely be intact and probably is. One of the things, when they can talk to you and you give them enough time to express themselves, they'll tell you their frustration is that people think they're stupid because they can't speak correctly.
Yeah, that's so hard.
Very hard. Yeah.
Yeah, I hear her frustration she's a Facebook friend. I had worked with her and she's a Facebook friend, and I read her posts and I could sense her frustration. Even though physically she's doing all these things and her walking is better, she's done all these things. But, and people don't think that in their 30s that they're going to have a stroke.
Right.
And she had kids and the whole thing was just difficult. I would like to talk to you a little bit about support groups for stroke survivors and some different ways that we can minister to those around us that have had strokes, because some of them have support people at home and some of them don't. And can you share a little bit about what your experience has been with that?
Well, I've been fortunate to get to co-facilitate a stroke support group for survivors and their care partners for 14 years. And it has been a wonderful time of learning from people who are actually living with the difficulties and with the people that know and love them. Support groups provide an opportunity for someone to share what they're experiencing, not to a medical professional, but to someone else who's living with the same thing. We used to use an example when new people would come to the group. One of our guys would say, I remember when I came here, so-and-so was having difficulty. And he said, I just can't butter my bread with one hand. I have so much trouble. I've done this, I've done that, I've done this. I made a little wedge on my cutting board and it still took off on me. And somebody in the group said, I had that too. And I got spray on butter. And it changed the guy's life. He was so happy. But it's just
I didn't even know there was spray on butter.
Yeah, I think it's a margarine actually. But anyway, they have things for each other where they say, oh, I know, I've experienced that. When you know someone who's had a stroke, encourage them to look online. And they could just type in their search engine, stroke support group near me, or they could go to the American Stroke Association, type in a zip code. There could be a stroke group in their town where they are living. Now, the other thing, sometimes not everybody has that. And then look, do they have a senior center? Like you mentioned, lots of people, sadly enough, can be younger than seniors. And we have those people in our stroke support group, but a lot of people are seniors, like maybe 70 to 80% of them. So also you could look in your town for the senior center, and they will have different groups happening. Sometimes, excuse me, sometimes it's a group that would help the person who's helping care for someone.
Yeah.
And they need a lot of support too.
I was going to ask about that, about caregivers. What are some things that you've experienced with talking with caregivers, or what are some suggestions you may have?
Well, they can be exhausted, or they can be emotionally exhausted. And it's like many other diseases or conditions or family situations where just having a break. So they need a break. Maybe someone, you could be the person who gives them that break. Like, I'll come over. Or someone in our group, a man, he wasn't going to sit in a house with someone, but he'd drive them somewhere. So they like to go to McDonald's to get that $1 cup of coffee. So you can volunteer to do something like that. Sometimes, like you mentioned, a lady who was young and had kids, sometimes it's like, can I help with a meal? Could I take the kids somewhere? What could I do to help them? So we have a support group. We invite our care partners in with our stroke survivors, and we split the group up when there's enough people. And chaplain goes with them and listens to them. A lot of it is they need someone to talk to, and they need practical help, and they need someone to talk to. You can be a friend, right? You could just be a friend to someone who needs help.
And I remember when you took care of Mama, our mom, for years, and I would try to come over, but I'm not a medical person. I don't understand anything about it or anything. And you'd say, I think our tank has enough left of oxygen. You'd say all these things. I was like, I'd be scared spitless because I really have no knowledge of any of that kind of stuff. And, but I just thought maybe it was just a little more fun for you to have a friend, someone there. Or maybe it was just more fun for someone to be able to just talk with the person. And so I think sometimes people don't really know what to do, but just sitting there or just being there or bringing some cookies over, people can do some things, even if they don't understand what stroke is all about.
Right. And those people have, unless they're alone in their house, there's other people living in the house. So just like many things, when you hear that you're someone in your circle of friends or neighbor has had a stroke, tell them, I'll take the garbage up to the top of the road. I
Yeah.
will feed your cat. Those people are at the hospital. Bring them a meal. Meal trains are helpful when people
Yeah.
first come home. You probably won't be able to feed the person who just had the stroke if they just did, because they might have a special diet. There's trouble swallowing in some strokes, but you could help take care of the people who are still at home. And that can happen, like a thing that can happen with any chronically ill person is they might get sick and have to go back into the hospital or need more care. Say they went to a rehab center after their stroke or a nursing home. Their family or friends that are helping care for them, they might be going back and forth to a hospital every day or twice a day or spending their time there. There's many needs you can meet, like a meal train or something that could help those families.
Yeah. I mean, just people know that you care. I mean, I think that's just such a big thing to be supportive. I mean, sometimes we just are driving along and we think of someone we need to send a card to or take a meal to or something. And then we're like, man, I should really do that. And then it's like a month later, you realize you never ever did that. And part of the purpose of Live Boldly Ministries is to follow through on that. Take purposeful steps to help people. Be intentional in the things you do each day to where you can really focus on those things that you could do to help someone. And I think there's so many people with strokes out there. I mean, I remember you saying once with a relative who had had a lot of TIAs that people can have tons and tons and tons of those, and they don't even know that they've had them most of the time. And so is that a fairly common thing? Like when you're a little bit younger? No?
Transient ischemic attack happens to people who are at risk for stroke. So some people are never going to have a stroke in their life. But when you have symptoms of a stroke, like we discussed, balance, eyes, face, arms, speech, you need to take that as seriously. You have to take that seriously and get a workup. So you have to still go in like you're having a stroke, because you don't know if that symptom is going to go away. And sometimes it's a little stroke. Sometimes it's not a stroke. Sometimes it's a warning sign, right? It's a warning sign. So we take it seriously. We get to the hospital, go to our primary care doctor. But if you have stroke symptoms, always call 911. The care starts the minute you call, because they're getting the information that we need and giving it to the care providers at the hospital. I wanted to say, your listeners are people who are going to take intentional steps, you mentioned. And
well, hopefully.
So they might be the person who sets up and gets the other folks around this family, supporting them, helping them, getting the meal train scheduled. And there's lots of tools out for that. Think about the kids. If they have kids, pets, people have pets. They do. All needs walking, right? And the thing about stroke and heart attack is it happens unexpectedly. You don't know when it's going to happen, and it's just happening like that. And then people need help. So there's a good opportunity for people to help these folks.
So you had mentioned earlier things we can do, like exercise and taking care of your diseases if you have some sort of thing going on, those kind of things. What are some just really basic general things for the general public that we could be doing? Because we don't know if maybe we're going to be one of those people, you know?
Well, I had a doctor once that was going to talk at a conference for me, and he stood up there in front of the microphone and he goes, I'm going to talk to you for an hour, but this is what I'm going to say. Move more, eat less.
There you go. we could certainly all do that.
And so then he went on to explain many things for an hour. So I tried to think of that one. everybody that's over 40 needs to have their blood pressure checked, and then they need to do what the provider tells them. We need to get our cholesterol checked when we're over 40, right?
Mhm.
And cholesterol can be very family driven, like your family, your body could make cholesterol. You have to get it checked to know what you're doing with that. But of course, that has to do also with what we eat. For some people, it's what we eat. So eating a diet, something like the Mediterranean, less meat, more fruits and vegetables, less carbs, get that exercise. You're a great one for walking and going on outdoor trips where you do exercise. That just needs to become a way of life. And you need to have that. I've met people who have insurance and jobs and they never go have their yearly physical. If you don't have your annual,
then you don't
at
know.
some point, you don't really know what you're working with. And those people show up at the hospital and go, I haven't been to the doctor in 10 years, like it's a badge of honor.
Yeah.
Well, guess
I was
what?
kind of like that. I was kind of like that because we're fairly healthy. And like you say, we're pretty active and such, and be aware of a lot of those kind of things. But our doctor had passed away and, or retired and then passed away. And then we just didn't get a new doctor for a while. And then finally we went in and we had our blood panels done. It's like 7 things, 8 things on each thing. And we were traveling and each of us got a separate call and there was one thing off, different for each of us. But so then since then, the last 4 or 5 years, we've gone every year to that yearly. And my lipid panel is the one that's off usually, and the others are perfect. But the last time I went, even though there's a couple of things off, she's like, oh, this is great. This is great. I'm thinking, how can it be great if there's a couple of things in the red? She goes, well, because it's a range, but you can tell what you've been doing. So I think you're right. It's like, keep aware of that. Go into a doctor, don't blow it off, and keep active, even if you're sore from doing something. Like I work outside for a couple of days and I can't move for 3 days now at my age, but I still am trying to plod for, like go forward and trying to keep up with things. And I think that's the thing, if you're going to just sit and be tired, or if you've done too much and then you sit for 5 days after that's not great, and then of course, food wise, we all, try to focus in on the things that are right, but we go astray and then we got to pull ourselves back. I think that's the thing. It's like if you mess up, then just start walking again. If you mess up, keep eating right again. Just keep, and then go to the doctor, see where you're at. I don't struggle with any high blood pressure or anything, but I do have a cholesterol problem. So, I mean, you just have to keep working at it and keep working at it and studying it. And I like the Mediterranean diet. It's packed full of all sorts of things that are good. And Lisa, let's talk a little bit about agencies, like websites and that sort of thing. What do you have more than one to give us, or just the stroke one? Or
well, the American Heart Association is heart.org and the Stroke Association is stroke.org.
Oh, wow.
So those are
I could even remember that. Yeah, that's good.
But you could just type it into your server and find it. And the thing about this, it's just the gold standard for us in stroke. You can trust what they say, or you don't have to go, well, I wonder if this is okay. Like if you just Google something medical, you could get who knows what you could get. There's many reputable, like I read things personally from 2 clinics that are very reputable and I trust them about other things. But for heart and stroke, the Heart Association is just, they're it. And some of the categories, and I know Craig might be posting this for us later, is it has about stroke, it has life after stroke, help and support. And sometimes someone might live in a really remote place and they don't have a group near them. And there's something called a warm line, which isn't a hotline, we know, like calling 911. But they have places even on here where you can ask a question. And another way people can get connected to information is like, say, their therapist. So if they go to PT or OT after stroke or something, they have good resources too. So your provider, you have more than just your provider. But I really trust, if it's written on the American Heart Association or the American Stroke Association, I feel very confident in referring that to someone. You can feel confident that someone studied this.
Yeah,
In
exactly. Yeah.
in the support section under stroke, there's a new area, relatively new, few years, called Stroke Onward. Stroke Onward was started by a woman who was in her 50s, who was a professor at Stanford, who had a stroke. It affected her speech. And when you think about that,
wow. Wow.
right,
Yeah.
it affected her speech. So Deborah Meyerson and her son wrote a book called Identity Theft: Rediscovering Ourselves After Stroke.
Wow.
It is, the sections are amazing, and the questions afterward are also, but they put a section, the American Heart feels, the American Stroke feels so good about it. They've added a section on their page with that. And that's sort of an encouragement to people to see what are people doing who had a stroke. She and her husband this summer in 2023 went across the country in bicycles.
Awesome.
And
Bicycles.
It was
That's
a
good.
little bit, and they did this. And so some of my stroke survivors, they were reading the journey, and seeing what is available. But they also have things on here about peer support, recovery communities. And I would suggest to people to go on there and look at that.
Awesome. Wow. Well, we have been talking today with Lisa Shumaker, who's an RN and has worked for over 40 years as a nurse. And she, about 15 years ago, I guess, got involved with stroke, and she's represented the state of Washington at several conferences and been on some TV shows. And we're so thankful to have had her today. I'm Nikki Corinne White, doing the podcast for Live Boldly Ministries. And we're just so thankful for you, Lisa, to come share, because we have all known someone or have someone that is struggling with this right now. And this is just a wealth of information and encouragement to people. And it is just a wonderful thing that you're doing and how you're helping people.
Thank you very much.
Thank you.
I'm glad you're going to get the word out.
Yes, exactly. Thank you so much, Lisa.
Bye-bye.
Bye.